Good morning, everyone. My name is Maya Luria with TMC for Seniors, and we are continuing on with our chronic pain series, and we are going to be talking today about sleep and persistent pain. I have Emily Rich here. She is an occupational therapist. She works with adults and adolescents at our TMC Adult Outpatient Therapy office, and she specializes in treating individuals with chronic conditions, including dysautonomia, such as postural orthostatic tachycardia syndrome, which is POTS, Ehlers-Danlos syndrome, and hypermobility, persistent pain, and Parkinson's disease. Today, she's going to discuss how persistent pain can impact your sleep and what you can do to get a better night's sleep. So, Emily, thank you so much for being here with us. We love to have you, and I know it's your first time at TMC for Seniors. I know you used to do quite a few presentations over at the core. So we want to welcome you here today. And I know you're sort of back on your old stomping ground because you used to work in this building when it used to be part of our PEDS therapy for TMC.
That's right. Yes, I used to be a pediatric therapist, and I spent years and years in this building when it was a gym and there were toddlers and infants crawling around.
So I can't hear you.
Oh, I'm sorry. I'll speak up. So it's great to be back in this space. I now work with adults and adolescents at our outpatient therapies, working with
Yes. So you could be watching us online today, or we also have a small in-person audience. So feel free to leave any questions for Emily. If she starts her presentation, you can leave them in the comments, and I will ask Emily afterwards. So I'm going to go ahead and pull your presentation up, Emily, and you should be all ready to go.
Okay, sounds good. Thanks so much, Maya, for that introduction. So today I'm going to be speaking about sleep and persistent pain and how those two things are often related in terms of getting poor sleep and having persistent or chronic pain. So first we'll go through an overview of what these things are, some definitions, familiarity with the research behind these two things. And then we're going to talk about strategies, hopefully probably what you're here for, right, is how do I do something about it? We'll talk about sleep positioning specifically, and then we'll leave time for questions at the end. So let's start with some definitions. We're going to look at poor sleep as difficulty falling or staying asleep, decreased efficiency or quality of sleep, and sleep apnea. Persistent pain is the term that I will use to describe pain that lasts more than 3 to 6 months, depending on the definition that you look at. And this is compared to acute pain, which is pain that lasts for less than 3 months. If you or someone that you know or love experiences persistent pain and difficulty sleeping, this cycle might make some sense to you. Sleep issues often lead to more pain sensations, and pain sensations often lead to worsening sleep or difficulty falling asleep or staying asleep. And this is the experience of many people. So why are we talking about sleep today in this series on persistent pain? Well, we know that sleep actually impairs our perception of pain, as just one night of poor sleep can increase our sensitivity to pain and the intensity of pain signals. You might look at this as a pain threshold, and so poor sleep is lowering that threshold, and so we're feeling pain more sensitively. Conversely, getting good sleep can actually decrease our pain levels or increase that threshold of tolerance of pain. You might look at it as a resilience factor, getting good sleep. And there's research to support that restorative sleep leads to chronic pain resolving, whereas people with insomnia are more likely to actually develop a pain condition, like fibromyalgia or something else. And finally, women with poor sleep were more likely to develop chronic pain 3 years later. So it does seem that poor sleep can precipitate the onset of chronic pain. So that's the effect of sleep on pain. What about the opposite? How does pain affect our sleep? Well, persistent pain may affect our sleep pattern and lead to non-restorative sleep, fragmented or superficial kind of sleeping on edge where just the littlest thing can wake you up. But we don't have as much research to demonstrate this side of the equation. When we get poor sleep, it actually affects our physiology, specifically the chemicals in our brain. For one, we have less serotonin released, and this is further perpetuated in a cycle with less serotonin with even less sleep. Serotonin is something that affects our mood, it affects digestion, sexual desire, and our sleep-wake cycles, to name just a few things. Some people call it the happiness chemical, and with lower levels of serotonin, we see more pain stimulation. With poor sleep, we may also experience anxiety in anticipating future nights of poor sleep. I think many of us in this room, if you're attending this lecture, might have some sense of what that feels like, right? You have one night of bad sleep or a few nights of bad sleep, and you're just starting to anticipate that that's going to happen again the next night. Poor sleep also disrupts our nervous system and can alter our body's sense of homeostasis. Overall, this can lead to this downward spiral where things just kind of get worse over time. To not be too negative here, I can't help myself as a therapist. We're not going to get into treatment yet, but I often like to tell people that although things can snowball in a negative direction, as we're seeing here, right, with sleep and pain, they kind of feed off of each other and they can really just get worse and worse. There's no reason to believe that things can't snowball in a positive direction too, that just changing one thing can really change the trajectory in a huge way. So we'll get to those ideas in just a little bit. Here's a visual of our autonomic nervous system. I can't give a lecture without talking about this when it comes to pain, because it's a big factor in terms of our perception and regulation of pain. This is just a gross, big picture view of what our autonomic nervous system is and does. But on the left side, you'll see here the sympathetic state, which is that fight or flight state, a really important, crucial state for us to be able to be in if we need to react quickly in situations of danger or threat. And then on the right side here, you will see our parasympathetic nervous system branch. And this is our rest and digest branch. This is where we want to be most of the time. When there's no threat present, we want our bodies to be able to be in that rest and digest state. Both of these are important and necessary. It's not one is good and one is bad. But often what happens if we live in persistent pain is that our body can become more sensitive to these alarm bells going off in our body and different things in our environment. We might be more sensitive to sounds. We might be more sensitive to sensations that we're feeling in our body. And our body might see those as danger signals and shift over into this fight or flight side of the nervous system. So what does that look like in terms of our body symptoms? Well, if you're in that left side more often, that fight or flight state, you might see that your pupils are opened larger, as we would naturally do when we're scanning for a threat. And sometimes that looks like more light sensitivity. People with migraines especially might experience this. We're focused more on our far vision, so it might be more difficult to look at things close up, for example, reading. And we might have more dry eyes because our eyes aren't secreting the same liquid that we need to lubricate them. Our salivation decreases and our heart rate increases. We have faster, usually more chest breathing, and our digestion is not functioning as well as it typically would be. We hold on to our urine, and our blood vessels close up, shunting all the blood to our core. So you might see cold or clammy hands and feet when you're in this state more often. So these are just some signals to you that you might kind of tune into. It's not necessarily, if you have dry eyes, there's lots of reasons you might have dry eyes, right? But if sort of multiple things are happening together, you might consider what are ways that I can help my nervous system to feel more safe in this environment. What about obstructive sleep apnea? Well, this is a condition commonly present in people with pain. And in those with OSA, they might have hypoxia or a decrease in oxygen in their body's tissues, along with poor sleep from their breathing pattern, the way that they're breathing. And this leads to more pain. Conversely, the opposite can be true. So it's sometimes hard to know which came first. It's sort of a chicken or the egg scenario. But we know that OSA and pain often go together. People with OSA have more morning headaches than those without, and pain levels improve with the use of a CPAP machine. This is not just a condition in people who are obese. That is sort of a wives' tale that we have taught in the past. And so someone who is not obese is still at risk of developing obstructive sleep apnea. On the next slide here, we'll go more into this stop bang screener. So you can see here the risk factors for screening using what we call stop bang acronym. And these are not necessary to have sleep apnea, but they make someone at higher risk. And you can see here, if you have 3 items that you say yes to, it's more likely that you would have OSA. So these are S stands for snoring, T for tiredness, O is someone observing that you stop breathing when you're sleeping, and then differences in blood pressure. BANG stands for a BMI greater than 35, which again increases your risk, but it is not a prerequisite. An age greater than 50 years old, a neck circumference greater than 40 centimeters, and being a male gender are all going to increase one's risk of developing OSA. Here at TMC, we have a sleep center, and that could guide you to testing and also treatment. And we begin as young as children of 1 month of age, not necessarily testing for OSA, but for other things with sleep, and going into older adults. And we both have in-lab and also home sleep studies. If finances are a concern, there's the contact information for a financial counselor there. Okay, so my favorite part of this lecture is what can help? What do we do about this stuff? So here's my sort of top 10 list of things that you can do to improve your sleep. We're going to go through these. There's a slide on each of these, so I won't go through them now, but sometimes we call this sleep hygiene, and that is something that occupational therapists often help people to implement, and that's what I am, an occupational therapist. So we'll go through each of these one by one. First off, getting natural sunlight first thing in the morning. And fortunately, we live in Tucson, where I don't remember the number of days, but it's a lot that we have sunshine. So we don't really have that excuse of cloudy days like other places. But this can help tremendously with what we call your circadian rhythm, and that is your sleep-wake cycles of your body. So I recommend getting at least 20 minutes of sunlight in the morning. It doesn't have to be outside. You can be inside next to a window, but really trying to get that direct sunlight coming in, sort of basking in it. Or being outdoors, of course, is a great option, especially this time of year. If natural light is not an option for you, or if you notice yourself having more trouble sleeping or more mood changes as we get into the winter months of the year, a light box is often recommended, and this should be at least 10,000 lux when you go to look for one. They describe how far out they project, so you want it to be at least 12 inches or a foot, because otherwise you have to be so close to this thing that it's probably not realistic. So those are some of the factors that you might look at if you purchase a light box. And then you want to make sure, again, that you're sitting close enough to it, that you're directly facing it. A lot of people will eat breakfast in front of light boxes. And then as an alternative, there are earbud options now where they actually serve as headphones, Bluetooth headphones, and they have a light inside of them that projects into your pineal gland in your brain, and it does the same thing as a light box. We obviously don't have as much research, but what we're seeing so far is good. And so that is something, if you're on the go and you really it's hard for you to sit in front of a light box or causes a headache, this is another option. I have no ties to this company, but Human Charger is just one brand that I know of. I think there's probably others at this point as well. All right, so number 2 is minimizing screen time in the evenings and avoiding it before bed. So we've all heard this before, but what are the reasons? So blue light is something that the gist is when you have this light coming in, it's telling your brain the sun just rose. It's as if, the sun sets in the evening, which is great for our circadian rhythm. That's really good feedback for our brain that we should produce melatonin. It's time to go to sleep soon. Well, now suddenly we put this computer screen, phone screen, or television in front of our eyes, and it's as if the sun just rose. So at least 1 hour before bed, really trying to minimize any screen use. And a lot of people I know fall asleep to the TV or fall asleep to music. Music is fine, audio is fine. Sometimes I'll encourage people to put a familiar show on their phone, turn the phone screen over and just listen to it. Or listen to a podcast, listen to music, but really trying to avoid having that TV light in your room, even if your eyes are closed. We now know that even just the littlest bit of light in a dark room can really affect your sleep. So making sure you're covering any source of light in the bedroom. So here are some alternatives I sort of just mentioned: reading, talking, relaxing, and then listening to the audio of a show. And then, as I mentioned, covering all lights in your bedroom. If you're concerned about falls, which I would be very concerned about as an occupational therapist, I highly encourage purchasing motion-activated lights that you can put throughout your home. I'm obviously a fairly young person, and I have these all throughout my house. So this is not a thing that I only recommend to people who are aging. But as soon as you step out of your bed, there's things you can plug into the wall that go into an outlet. There's others that you can charge that don't need an outlet. And when there's motion, it turns on. So if you need to go to the bathroom in the middle of the night, you're safe and not keeping a night light or something else on that otherwise could be disrupting your sleep. Reserving your bed only for sleep and intimacy. So I talk to college students regularly that I see who, are in a dorm and that's their only space and they're doing their work in their bed. Or now in the era of working from home, we have a lot of people who work, do their daily work from their bedroom. And especially the bed should be devoted just to sleep. But in reality, the whole bedroom should really be devoted just to sleep and intimacy. Our brain has a memory for space. And so if we have been working or doing something in our bedroom besides sleeping, when we get back in there in the evening, our brain goes back to what we were doing. We start to sort of rehearse that work or, the phone call or whatever it is. So the best thing you can do is when you wake up in the morning, get out of bed. If you need to still lay down, wake up, go on the couch, find another area of your home to do that. And then same thing before you go to sleep. Really try to avoid going in bed for prolonged periods of time before you fall asleep. And then you might consider making the space look and feel different for bedtime. So I give the example sometimes, I actually had shoulder surgery at one point, and I slept in a recliner. And so my day-to-day life in a recliner was very similar to my nighttime sleeping. And so what I did is really change that space to feel like a bedroom in the evening and feel like daytime during the day, even though I was sitting in the same recliner. So I would put a sheet on it. I would change the lights, I would sort of turn everything down and convert the space. So that's an alternative if you live in a home that's like a studio apartment or something, but trying to really make that change for your brain. And then ensuring a cool temperature at night. What happens is when we start to fall asleep, we cool down, our temperature cools down. And so kind of one trick for this is to take a shower at night. Your body automatically warms up when you're in the shower. And when you get out of the shower, it's bound to cool down just from the air, or you can change the temperature of the water at the end. And that provides a cue to the brain that it's time to fall asleep. So if you have a really warm sleeping environment, that's something that you might consider, is if you can decrease that temperature. All right, next up is engaging during the day. So doing things during our day to make sure that we have that drive for sleep. We sometimes talk about sleep drive. And so what are things we can do during the day to help us sleep at night? Well, physical activity, which Jake, my colleague who's a physical therapist, just spoke on, I think it was this week, but recently. And physical activity can be a really good benefit for sleep as well. Movement in general, so sometimes people struggle with the word exercise, like I can't exercise, or that word is kind of triggering for me. And so just this idea of movement, that can be as simple as laying on the floor and sort of rolling left and right, stretching, bringing a knee up to your chest, just getting some motion and getting your blood circulating, basically, is what we're looking at. Socialization is another way to engage during the day. We know there's all kinds of benefits of eye contact and communication with other people. And so that's a really good way to help increase your sleep drive. And this idea of endorphins, which are sort of good chemicals in our brain, like serotonin that we discussed before. And so just different ways to participate and have, your day look very different from the evening. Decreasing your arousal in the evening. So again, helping that nervous system to shift into the rest and digest state. Not everyone, but it's possible that, especially for people with pain, there's sometimes minimal things in our day-to-day life that we don't know is sort of setting our nervous system off. So there's some people that I see who have heart racing at night, or they wake up in the middle of the night in sweats, feeling pounding, and not really understanding where that came from. It's not from a nightmare or something. And my understanding from what I know from the research, and also just from what I hear people describe, is it's not unlikely that during the day, your body is more in that fight or flight state. Doesn't mean that you're feeling like you're scared all the time, but the nervous system doesn't feel like it can fully relax. And so then when you get into that state in the evening, it's sort of confusing for the brain and it's challenging to get into that state. So one of the best things we can do is to use those evening hours after dinner, when the sun sets, to help the body to know that we can go safely into that rest and digest state of the nervous system. Weighted blankets are something that sometimes people use. It's not just a trend, it's something that occupational therapists have been using for decades. And basically it's that feedback to help ground the body and to tell the nervous system it's safe. There's lots of different things, but you might brainstorm a list of 5 things that you could do. And sometimes I tell people to make sort of a busy basket so that you're not sitting there thinking, what am I supposed to do to relax myself? But you can just go to this basket or area of your room or your house and have ideas, whether it's knitting, crocheting, crafts, coloring, listening to music, puzzles, all kinds of things, but things that help to turn off the brain and still keep your mind and your body sort of busy. Evening walks can help to reinforce their circadian rhythm. So I mentioned, when the sun rises in the morning, trying to soak up that sunlight first thing in the morning, tells the brain time to wake up. Then if we can follow that with an evening walk, either before sunset, at sunset, or after, again, helping to reinforce the circadian rhythm, telling the brain it's now time to go to sleep. Next is maintaining consistent meal times. Another component of our circadian rhythm, it's not just the sun rising and the sun setting, but our meal times are actually factoring into our circadian rhythm. So if you're a person who eats 1 meal a day, or you're really inconsistent about when you're eating, trying to think about, having like those 3 or 5 scheduled times and relatively speaking, trying to stick to those. It just creates that rhythm for the brain and for the body to really know what is happening, and our bodies crave routines. And so, having that routine in place can be helpful and predictable. And then some people feel like eating something within 1 hour of waking helps to kickstart that circadian rhythm in the morning and reinforce that. So If you feel, appetite-wise, you're able to eat something within the first hour. If not, even considering, a half of a banana, a half a granola bar, like just something small that you could eat within an hour of waking up. And then in the evening, really trying not to eat within 4 hours of falling asleep. So letting the body have that time to digest your food, which actually takes quite a bit of energy for our bodies to do. And, being upright, helping gravity to help you digest. And then your body is more prepared to just rest throughout the night. It's not having to work as hard. Smaller, more frequent meals are often easier on digestion. And if you are feeling that overactive stress response or that fight or flight response, your body is going to have more difficulty digesting food. And so considering how smaller meals, easier to digest meals, will be just easier on the body in general. Trying relaxation throughout the day and in the evening. I think what's challenging with relaxation is, how do we relax? What does relaxing look like for you? And so I'm not going to tell you that you should meditate or do mindfulness for 10 minutes, 3 times a day. Those kinds of prescriptions are usually not helpful for people. We want to look at individually, what is relaxing for you? That can be conversation, as long as it's not too stimulating, like political conversation, like right now. It could be hanging out with pets, especially if they're calm in the evenings. So that's one component, right, is choosing what is relaxing for me. The other component is a lot of people think, well, I just need to do meditation or mindfulness right before bed, and then I'll be relaxed and I'll be able to fall asleep. Well, unfortunately, as I mentioned earlier, a lot of people begin to have anticipatory anxiety or feeling like, oh my goodness, I'm not going to be able to sleep. And so then trying to counter it with relaxation, for some folks it works well. For others, it actually creates more anxiety because they're saying, I have to relax, but I'm really anxious because I probably won't be able to fall asleep. And so often what I find is trying to do relaxation throughout the day, not just before you fall asleep. You might also do it before you fall asleep. You might actually avoid it before you fall asleep if it starts to cause more anxiety, but considering what works best for you. I mentioned that fight or flight response. And so if we go all day long, in that more heightened nervous system state of sort of being on edge, a door closes or a dog barks and you kind of jump, or feeling just sort of antsy, it's not necessarily going to be as helpful to just try relaxation at night. We really need to try it throughout the day to decrease that hyperarousal all throughout the day. So some ideas are breathing. In and out through your nose is usually the most relaxed breathing. We don't need to do forced exhale. That's one type of breathing, but you don't have to. So just in and out through your nose, building up to a longer, slower breath. More than deep breaths, I like to encourage people to take slow breaths. And building up this to practicing before bed if you're able. But as I mentioned, it's often better to start this at other times of the day. The longer your exhale, the better, the more relaxing that is. Your heart rate goes down on your exhale, your heart rate goes up on your inhale. And so if you inhale for 3 seconds and exhale for 4, 5, 6, 7, that's going to probably be a better situation for relaxation breathing. Another idea is a warm bath or shower. Music, conversation, crafts, puzzles, pets. And again, just limiting this anticipatory stress around not being able to sleep. Next is avoiding or significantly limiting naps. And I know especially in older adult populations, this is often challenging. And this is where, activity during the day often comes into play. Trying to have those things built into the day, making sure that we're limiting the amount of time spending, on the couch or in a chair watching TV and trying to really separate that sleep time from that wake time. What we know is that napping decreases our body's sleep drive, or the sleep pressure that we feel in the evening because we slept earlier. I know there are lots of people who have to sleep during the day, and that's just the way that it is. And so if that's the case, trying to keep it under 15 minutes, which is a power nap, and especially trying not to sleep after 4 o'clock in the afternoon. So that's definitely when we get into, if we're sleeping until 5 o'clock, 6 o'clock, there's going to not be as much of that sleep drive in the evenings. It's usually better to push through when we think we need a nap at 5 or 6 or 7 o'clock and just go to bed slightly before or at the same time. But again, needing to keep ourselves busy, right? Needing to give ourselves something to do. Monitoring caffeine and alcohol intake, and this is very individualized. Again, the sensitivity to alcohol and caffeine is so dependent on each person. But at the end of the day, caffeine is a stimulant. And so really trying to limit or avoid it after noon, including decaf. We know that decaf is not uncaffeinated, it's just less caffeine. So just recognizing that that evening glass of, the evening mug of coffee, even if it's decaf, can also disrupt our sleep. So I'm not telling you you can't drink your coffee in the evening, but just consider it for yourself and whether that's something that is disrupting. Switching it out with an uncaffeinated tea, like an herbal tea, can be another similar, different I know, but similar sort of sensation. Again, it's reducing that sleep drive. And then alcohol originally may make you feel sleepy. A lot of people say I have to have my glass of wine before bed. But what we find is usually more than one glass of wine or more than one cocktail usually leads to people waking up in the middle of the night. It disrupts sleep. People might have more superficial levels of sleep. So rather than getting into those deeper sleep states, they're sort of hanging out more superficially. So something to consider. Again, just looking at the amount that you're taking in especially. And then as I alluded to earlier, our body loves routine, and that is true for our sleep routines as well. So maintaining a consistent sleep schedule, and usually the best thing we can control about our sleep schedule is when we wake up. It's often harder to control when we fall asleep. Now we can set ourselves up for success, and I'm highly going to encourage that. That you don't push back, needing to do things until too late, that you give yourself time to prepare for bed. But maintaining that wake up time is what we have more control with alarms and things like that. So I often compare it to a baby with a schedule, like napping, feeding, going to the bathroom, like those very consistent patterns. Those are much more ingrained in us, and we don't have to think so hard about them if they're consistent. And so that can really help when we're having poor sleep. It's better to push back your sleep time if you're not tired, rather than to try and force yourself to go to sleep. So that's where I say, especially keeping that wake time consistent. But if you're really trying to get to bed at 9 o'clock and 9 o'clock comes and you're not tired at all, don't go to your bed at 9 o'clock. I would highly discourage that. That's sort of an older approach to sleep. And now what we usually tell people is you're better off waiting, trying to build up that sleep drive, that tiredness, and go to bed at 10 or even 11. And then over time, our hope is that you're going to be able to more consistently fall asleep at the same time. But if you feel like I have to get to bed at 9 o'clock, I'm laying in bed, I'm not tired, that's going to build up that anxiety, and you're going to have more of those concerns in next days following. If you are planning to change your sleep schedule, try to do it in small increments at a time. So again, I alluded that I see a lot of teenagers especially, but this can be true for a lot of folks that they end up not falling asleep until 11, 12, 1, 2 a.m., even later than that. And rather than saying to them, you need to go to sleep at 9 o'clock or 10 o'clock, we're looking at, well, if you don't fall asleep until midnight, try falling asleep at 11:30. Again, if you're not tired, I don't want you to go to sleep. But if we start with that morning wake up at 7 a.m., 7:30, whatever it is, hopefully that's going to increase your sleep drive to fall asleep a half hour earlier. Usually do that for at least a week before you would bump it up another 30 minutes. All right, so those were my top 10 tips. I could go on and on about sleep, but that's sort of big categories that I like to talk about. And then we're just going to touch on sleep positioning. The reality is that we don't have a ton of research that supports sleep positioning in pain. Okay, so a lot of people might think, well, it just depends on if I lay on my side or my back and if I have the right pillows. Some people, it is the ticket, but I would say that is the minority of people. Those other things are typically more important. But given that we do know some things about sleep positioning, angles are important, right? And so you can even see in these photos here, your head and neck should be at a neutral angle, or basically straight from your spine to the back of your head, not having that really arched forward or falling back position. Maintaining the natural curves of your spine, and so you might see that low back picture in the top. You can see how there's a little pillow or a towel underneath that low back curve, because we all have that. That's normal. We shouldn't be straight through there. And so supporting that. Trying to avoid the fetal position, which a lot of people like, especially people in chronic pain. And so creating more curving of the spine, that creates more curve of the spine, especially in our neck, if we're in that position where we're forward, and can contribute to more pain, even though it feels comfortable in the moment. In terms of breathing, make sure that airway is open and has the space needed for optimal breath. And try not to collapse at the throat there, anything that could be obstructing that airway. And muscle relaxation is the goal. And so limiting any positions of tension. And so if you feel like, these are just some ideal ways to position, but if you think I really need a pillow here, or I'm feeling a strain in this place, trying to support it, that's the best thing that you can do for yourself. We don't want you to be, in this perfect ideal and feel all this tension. That's not ideal for you then. We have to individualize this. So specifically looking at pillows, pillows are your friend. Therapists love pillows for a reason. So standard pillows are usually fine, just having more of them than you think that you would need. But other people like wedge pillows as well. You can see in the bottom right corner. And pregnancy, or those U-shaped pillows in the bottom left corner, are sort of like floating on a cloud. So those can be really helpful for people who have pain, even if they don't need it otherwise. Again, the head and neck should be neutral or straight. So if you look at that top picture, the top left, the pillow is too high. You can see that neck is going up. And on the right side, the neck is going down. You can see that subtle curve of the spine versus the one in the middle toward the bottom. So you might even have someone take a picture of you or come look at you, because it's pretty hard to see this for ourselves. Even if you have a mirror, you're going to end up turning your head to look. So placing a camera, on video and laying down and then coming back and looking at your camera, or ideally having someone else take a picture of you, might be a good way. For back sleepers, you might want a lower or less thick pillow under your head, because that might cause more of that neck flexion or that kind of throat closing position. For side sleepers, you might need a thicker pillow, and usually medium to firm is preferred. And then for the low back, you might consider putting a pillow under the knees to relieve pressure. So I don't have a great picture of this on this slide, but you'll see it on the next few slides. But oftentimes, if you lay down and you feel that pressure on your low back, which a lot of people do, putting a pillow or a wedge under the knees is often a good strategy for that. So if you are a back sleeper, we're going to go through each back side and then stomach sleeper. So this is the ideal if you're a back sleeper to, again, have that neutral spine under your neck. And then again, here's on the second picture here on the left side, you can see that pillow under the knees or a wedge under the knees. Again, that's on the bottom right picture as well. And then you can just reinforce with this pillow idea for the cervical spine or the neck. Side sleeping, lots of pillows is key here. So you can see just a few images of how people might want to try for them. So having a pillow between the knees helps to limit the strain on your hips and back. So the bottom left picture, you can see the difference in the top versus the bottom. So the top one has a pillow between the knees and the bottom one does not. And you can see what that does to the hips. So, when we're standing, we usually keep our legs about hip width apart. But now suddenly when we lay on our side, gravity is taking that down and it can be hard on the hips through, for a prolonged period of time. And then trying to bend the top knee is preferred for some people, that top right picture, or obviously you can keep it straight as well. And then some prefer to have a thin pillow under their hip. So the top right picture, pillow number 3, is showing that. So it's a pillow behind you under your hip. It can help you from feeling like you're sinking back into the bed that way. And again, avoid curling into that fetal position, which a lot of people like so much. So preferably, we would encourage you to sleep on your back or your side. But for those of you who insist and have to feel most comfortable on your stomach, this is not encouraged. But if you're going to sleep this way, here are some ideas about what you could do. So it's discouraged because there's usually strain on your neck and your low back when you sleep on your stomach, and it's more likely to obstruct your airway, especially people who turn their head. I think we all know in our heads how that might not be a great thing to have our necks turned all night long. And so if you can, put a small pillow or a towel under both your pelvis or your lower abdomen, and then also under your head, or you can lay flat on the bed. So you can see how this person has multiple pillows propping them up. And that way, when their head is down, they're not as cocked up or backwards. And so instead, they have that more neutral neck alignment. So that's that propping of the chest. And then lifting the feet with a gentle bend of the knees can ease tension. So if you picture yourself laying on your stomach, your legs go pretty straight back. And instead, if we can elevate the feet a little bit, it gives a little bit of a bend, which can help with some of that low back and sometimes hip pain. People regularly ask me what kind of mattress is best for people with chronic pain. And honestly, I don't have an answer for you. It just depends on the individual. So mostly I encourage people to go to a mattress store, spend time in the beds. I don't think they really care too much. So just kind of find what works for you. But the different types are an inner spring, which is a traditional mattress. There's memory foam, which are all foam mattresses. And now there are hybrid options where there's multi-layers of foam and spring. So these are generic recommendations. Again, might not be true for you, but a side sleeper usually likes a medium to soft density, and a back or stomach sleeper usually prefer more firm density mattresses. Fun fact, mattresses only last 7 to 10 years typically, and an inner spring or those traditional mattresses really only last 5 to 7 years. So it's kind of amazing how often I have someone who has back pain. Low back pain is the most common form of persistent pain. And just getting a new mattress helps tremendously. So as much as I say, I can't tell you what kind of mattress to get, I would not discount how important a mattress is to pain or preventing pain. We spend a lot of time on this surface, and so it's really worth it to invest in something that is good quality. Other considerations are the weight of the person laying in the mattress, rotating the mattress regularly, and maybe flipping it over depending on the type of mattress that you have. If you can see some sagging in the middle, then one of two things should be done. You should get a new mattress, or there are cushions that you can buy on Amazon, for example, that you slide underneath the bed, and it's like magic. Suddenly it's not sagging anymore. So if you're not in a position where you can buy a new mattress, at the very least, I recommend getting a very firm cushion that can slide underneath. There's like Sag Away, there's different names for these different kinds of brands, and then considering the quality and the make, because that will determine in large part how long it's gonna last and how comfortable it is. All right, and then lastly, this is just a slide. I think, by talking about vitamins and supplementation is really outside of the scope of this lecture, but it's something that you might bring up to your healthcare provider, is vitamin D. So we know that it likely plays a role in both sleep and pain, vitamin D. And although we don't quite understand all of the mechanisms and reasons for how it works, we commonly see that changing vitamin D levels can help with both sleep and pain. And so this is sort of a diagram showing, that it can help with increasing your sleep quality, decreasing your pain, and then this Th2 response as well. And perhaps most importantly, it's not supplementing with vitamin D in isolation, but doing so with sleep hygiene and treating any underlying sleep disorders as well. So sleep hygiene being what we just went through. Those together are going to really help to decrease pain, increase sleep quality, and then perhaps have that effect on overall vitamin D. So just something to talk about more with your provider. So this diagram that I showed at the beginning, that worse sleep leads to more pain leads to worse sleep. After going through this today and understanding the literature, there is some question about whether or not that really is a two-way cycle, or whether poor sleep is often really the contributing factor for the pain, and that really being the underlying issue for a lot of folks. So hopefully after listening to this today, you are hearing that there are lots of different things that we can do, lots of different approaches that can help both sleep and pain. And usually helping one or the other helps both. There are some resources. There's an app called CBTI. It's Cognitive Behavioral Therapy for Insomnia. It's free. I recommend it to anyone having issues with sleep because there are lots of tools on there. There's some guided relaxation. There's strategies for scheduling worry time. There's all kinds of tools in there that often going to a sleep therapist would encourage you to use. So those are right there, free in the app. And then also you can get help here. I work in outpatient therapy. These lectures are not intended to get us more patients. We have a lot of patients with chronic pain, but we're there for you if you need us. So we just want you to know that that is a resource for you. And then there are cognitive behavioral therapy for insomnia, CBTI programs. There's ones online that you can take virtually from your home. And there's also resources for people who do that in person, both locally and nationally. And then again, as I mentioned, sleep studies are often helpful for understanding if there's any underlying sleep disorders going on to rule that out. And we do have a sleep center here at TMC. And with that, I'm happy to take questions. I think Maya's going to read the ones from online first, and then I'm happy to take all of your questions here.
So thank you so much, Emily. You covered a lot of territory, and I know I need to change my mattress. So that's the one thing. So especially when you talk about the years that you can really you should really have your mattress. But
amazing, yeah.
What do we do? How do we relax and not focus on the pain? Let's say you've got really bad back pain at night when you're trying to fall asleep. Is it the breathing, or do you have any other suggestions that somebody might want to try as well?
Yeah, I think this is such a common issue of if I have pain, how am I supposed to relax? People want us to do body scans, they want us to do breathing. But when I turn off all the other stimulation, all that I can think about is the pain that I'm feeling. So it's a really common shared experience. And the best thing that you can do is find something that works for you individually. For a lot of folks, breathing is not it. It is too much, too quiet, too much of turning down any other distractors. I am all for mindfulness kinds of exercises that involve other ways to focus our attention on other things. And so that might be like a walking mindfulness meditation where you're focused on your feet touching the ground with each step and your weight shift. That might be, into mindful eating, where with each food that you're eating, you're thinking about all the sensations that are happening and, textures and everything. Or you can think about, where did that food come from? Who are all the people that were involved in that food getting to you? From planting the seed to picking the crop to shipping it and creating it. And so these other ways of being mindful and aware and trying to promote relaxation without focusing on those challenging sensations. And then there's also some really good, I'm actually going to talk about this in the next lecture that I'll give, so hopefully that will be helpful too. But there are some good body scans that are more focused on people with persistent pain. One of which I really encourage is Kristen Neff, who does self-compassion work, and she has a compassionate body scan, and it's such a different body scan. And it's very much of, if I feel something, can I send compassion to that area of my body, rather than trying to ignore, avoid, or divert our attention, but just, having something to do to that. And then finding appreciation for areas of our body that aren't in pain. So it really is so specific, and sometimes working with an individual therapist is the best way to find, what is the best thing for you. But those are just a few ideas. It doesn't have to be this sort of like hum and really quiet practice that I think a lot of people think that it needs to be. So.
Okay. And if somebody did want to come to adult outpatient therapy, I did want to put the number up, and just so that we have it out there, but that number is 520-324-7005. I know you do need a referral then from your physician as well to see somebody over at outpatient therapies, correct?
You do. You just need to ask any medical provider. It could be a nurse practitioner, it can be a physician, whoever, to send a referral for occupational therapy or physical therapy. We also have speech therapy to get individualized therapy, and that should be covered by insurance. We accept pretty much all insurances. So.
And also our sleep lab, which would be another option. I know you had mentioned that as well. I did just want to share that number again too. That is 520-324-33. That requires a referral as well. But somebody can go in. There's a couple of different options, I believe, for sort of having an evaluation, a sleep evaluation. So that might be able to help as well. So I want to thank you so much for being here today, Emily. I know you are coming back. We're going to get to see you again at the end of November, and you're going to be continuing this series with mental health and persistent pain. And so that will be on Wednesday, November 30th at 10 a.m. So we hope everyone will join us then as well. So thank you so much for being here, Emily, and I will send it back over to you to finish up in the room.
All right. Thanks so much, Maya.
So if you have anything else, we've got our next talk is going to be actually for Diabetes Day. So tomorrow is our diabetes series. It will be on Thursday, November 10th, starting at 9:30 a.m. We have two different talks that will be happening tomorrow. It will be What's New with Type 2, Reviews and Updates. And then starting at 11 a.m., we have Eat Better, Get Better for Diabetes Nutrition. We hope to see you then. If you are interested in joining us for that from home, please give us a call in the office. We'd be happy to get you registered. The phone number is 520-324-1960. Thank you.